Everyone, I am Rose Jane Arina, and today I will be tackling about the pulmonary Langerhans cell histiocytosis. So what is this PLCH or pulmonary Langerhans cell histiocytosis? So previously it is called eosinophilic granuloma of the lung, also pulmonary Langerhans cell granulomatosis, and pulmonary histiocytosis X. So it is an uncommon cystic interstitial lung disease that primarily affects young adults. So PLCH or the pulmonary Langerhans cell histiocytosis is a rare disease that affects the lungs. So it is characterized by the abnormal growth of the Langerhans cells. So ano nga ba itong si Langerhans cells? So si Langerhans cells ay type ng immune cells sa ating lungs. Pero these cells are usually found in the skin. But in pulmonary Langerhans cell histiocytosis, they accumulate in the lungs, causing inflammation and damage. Next is we have the signs and symptoms of this PLCH. So the most common symptom is cough, which may be dry or they produce phlegm. Another one is the SOB or shortness of breath. So it is another frequent symptom, especially during physical activity. And also chest pain can occur. After that, let's have the risk factors. So first, we have the smoking, and second is the race, because almost exclusively found in white people. So PLCH is more commonly seen in white people primarily because of the strong association with cigarette smoking, and historically, white populations have had higher smoking rates compared to other ethnicities, making them more susceptible to developing the disease. Essentially, the higher prevalence of smoking among white individuals is the main reasons kung bakit or is the main reason for the observed disparity in PLCH cases. Let's move on to the anatomy and physiology. So pulmonary Langerhans cell histiocytosis is proliferation of monoclonal Langerhans cells in lung interstitiums and air spaces. So diba, lungs make up a large part of your respiratory system, which is the network of organs and tissues that allow you to breathe. Your lungs make oxygen available to your body and remove other gases such as carbon dioxide from your body. This process takes place sa 12 to 20 times per minute. When you inhale through your nose or mouth, yung air nagta-travel siya down to your pharynx or the back of your throat, passes through your larynx and into your trachea. So, your trachea is divided siya into two air passages called bronchial tubes. So, yung isang bronchial tube leads to a smaller air passages called bronchi and then into bronchioles. So, the bronchioles end in tiny air sacs called alveoli, where oxygen is transferred from the inhaled air to your blood. So alveoli looks like clusters of small round fruits. So after absorbing oxygen, the blood leaves your lungs and is carried to your heart. From there, it's pumped through your body to provide oxygen to the cells of your tissues and organs. So when cells use oxygen, they produce carbon dioxide and transfer it to your blood. So your bloodstream carries the carbon dioxide back to your lungs. So if nag-exhale ka na naman, mari-remove mo yung carbon dioxide. So after the anatomy and physiology, let's move on to the pathophysiology of this pulmonary Langerhans cell histiocytosis. So diba, ang PLCH ay isang sakit kung saan ang mga Langerhans cells or the type of immune cell ay nagpaparami ng hindi normal or the abnormal growth sa ating lungs. So, ang mga ito ay nag-iipon or sila ay nag-iipon sa bronchioles at alveolar interstitium na nagdudulot ng inflammation at damage sa ating lungs. So the exact reason or the exact reason or dahilan ng PLCH is still unknown. Ngunit the smoking ay itinuturing na isang pangunahing rason na kung saan nakaka-develop or nagpapaunlad ng sakit na PLCH. So, ang smoking ay naglalabas ng mga, 'di ba, ng mga chemicals na maaaring mag-trigger sa Langerhans cells na magparami ng hindi normal or the abnormal growth. So, first is, let's move on to the disease process. So, first is recruitment and proliferation of Langerhans cells. So, ang PLCH ay nagsisimula sa pagpaparami ng mga Langerhans cells sa lungs. So, ang mga cells na ito ay karaniwang makikita or matatagpuan sa balat at mga lymph node. Pero sa PLCH, sila ay nagpaparami ng hindi normal or the abnormal growth sa ating lungs. So, after that is the formulation of granulomas. So, what do you call this? So, if tipon-tipon na yung mga Langerhans cells na nagdudulot na siya ng inflammation at damage. So, ang mga cells ay naglalabas ng mga chemical na nagdudulot ng panghihina sa mga tissues ng ating lungs. So, after na manghina yung mga tissues sa ating lungs, we have the lung tissue damage and cystic lesion. So, ang pamamaga at damage sa mga tissues sa ating lungs ay maaaring ma-develop into pag-create or pag-develop ng cystic lesions na mga maliliit na lesion sa ating baga. So, ang mga cystic lesions ay maaaring magdulot ng problema sa paghinga, shortness of breath, ganyan. So, next is after nun, nang magka-damage na yung lung tissue natin, magka-cystic lesions na, we have the functional impairment of the lungs. Syempre, kapag na-damage na yung tissue sa lungs natin, yes, maapektuhan talaga yung paghinga natin. So, ang PLCH ay maaaring makaapekto sa function ng baga sa iba't ibang paraan. Maaaring magkaroon ng pagkakaroon ng problema sa paghinga, we have the cough, the chest pain. So, ang mga pasyente na may PLCH ay maaari ring magkaroon ng pneumothorax. So, as we all know, pneumothorax this is a condition in which may pumapasok or may hangin sa ating mga pleural space or espasyo sa pagitan ng baga. Then next is the increased risk of cancer. So, ang mga pasyente or ang mga taong may PLCH or the pulmonary Langerhans histiocytosis ay may mas mataas na tsansa na magkaroon ng cancer sa baga. Yes, dahil ito sa paninigarilyo na isa sa mga rason kumbaga ang paninigarilyo ay isa sa rason kung saan magkaka-develop ang pasyente ng parehong PLCH at cancer sa baga. So, ang PLCH ay isang seryosong sakit na maaring magdulot ng malubhang komplikasyon. So, it is really important to know the pathophysiology of the disease upang para makatulong na maiwasan at gamutin ito. Now, let's move on to the surgical management. So, first, we have the surgical lung biopsy. So, ano itong surgical lung biopsy? So, ito ay isang procedure in which kukunin yung tissue samples with a special needle to determine if cancer or other abnormal cells are present. Another one, we also have the chest tube placement. So a patient with pulmonary Langerhans cell histiocytosis would likely need chest tube placement if they experience a spontaneous pneumothorax, which is a common complication of the disease, often due to the cystic lung changes it causes. So this typically requires chest tube insertion to re-expand yung na-collapse na lang ng pasyente and may necessitate further interventions to prevent reoccurrence. Then, another is the lung transplantation. So, a person with pulmonary Langerhans cell histiocytosis may need a lung transplant if they have advanced progressive disease despite other treatments like smoking cessation, yung pagtigil na sa paninigarilyo, and are experiencing significant respiratory insufficiency, meaning their lung function is severely impaired and impacting their quality of life. This is typically considered a last resort option for otherwise healthy individuals with severe cases of PLCH. Let's move to the medical management. So first, we have the corticosteroids. So some physicians prescribe oral corticosteroids for patients with progressive disease, but there is no controlled proof of their effectiveness. Next is the supplemental oxygen. So ito ay used to treat hypoxemia. Then symptomatic treatment. So pulmonary Langerhans cell histiocytosis, symptomatic treatment primarily focuses on smoking cessation as the most effective intervention. Siyempre, meron din tayong mga nursing management. So, nursing management of this disease involves the systematic planning, organizing, coordinating, and controlling of nursing staff, resources, and services to ensure the delivery of safe, effective, timely, and correct patient care. So, first is assess the patient's current condition and signs of symptoms encountered. Why? Simply because assessing a patient's current condition and signs of symptoms is essential for accurate diagnosis, personalized treatment, effective monitoring, early detection and prevention, and improved communication. So this comprehensive approach is fundamental to providing quality healthcare and achieving optimal patient outcomes. Next is to monitor and manage signs and symptoms. Monitoring and managing signs and symptoms is essential for early detection of changes, prevention of complications, assessment of treatment if effective ba, individualized care, patient empowerment, and improved communication. So this ongoing process is an integral part of providing high-quality healthcare and achieving optimal patient outcomes. Also, we need to relieve pain and discomfort. Relieving pain and discomfort significantly improves quality of life, enhances healing and recovery, reduces anxiety and stress, improves function and mobility, enhances patient satisfaction, and also upholds ethical principles. So it is an essential component of comprehensive healthcare, ensuring that patients receive the best possible care and experience a sense of comfort and well-being. Next is to administer prescribed medication and also to help teach our patient. So, provide health education on the benefits of smoking cessation since ang smoking ay isa sa factor kung bakit nagkakaroon or nagkakadevelop ng PLCH yung tao. So, health education about smoking cessation is essential for reducing the burden of tobacco-related diseases, empowering individuals to make informed choices, and promoting early intervention and prevention, supporting quit attempts, and encouraging healthcare professionals to address smoking. By investing in comprehensive health education programs, we can create a healthier society for everyone. So, we have this nursing diagnosis. So, first is ineffective airway clearance related to excessive mucus as manifested by abnormal breath sounds, shortness of breath, decreased O2 saturation, and increased production of sputum. Second, impaired gas exchange related to deficit oxygen as manifested by difficulty of breathing. Third is ineffective breathing pattern related to associated condition. So that is all about the pulmonary Langerhans cell histiocytosis. Hopefully, meron kayong natutunan about sa sakit na ito. And that is all. Thank you.